Practicing medicine without insurance is possible. Imagine a private practice where you get to see your best patients every day, providing medical services you truly enjoy, all without the hassle of insurance. My name is Dr. T. Nguyen, and I'm a recovering specialist who was completely burned out from insurance-based medicine. I pivoted into direct care, where patients pay me directly for my medical services and have never looked back. If you're a private practice owner or planning to become one who's looking to be free of the grind of insurance and you're craving simplicity, efficiency, and connection with patients, you are in the right place. This podcast will help you map out your exit plan and uncover the mindset needed to thrive in today's economy. Welcome to the Direct Care Podcast for Specialists.
Hey, happy summering. I hope you're in the season to enjoy the weather and do more fun things with the people you like. My birthday is coming up in July, and yes, I'm a summer baby, also a Cancer, and I'm really excited to take a solo trip to Paso Robles. This is just a weekend trip my husband gifted me. I appreciate that he knows that I really do enjoy time by myself. I'll share more about the trip when I get back. I've been really craving connecting with myself. I think I've diverted far away from myself throughout my medical training, residency, fellowship, getting my first job, quitting my first job, opening my practice, and then just adopting this new role as a wife with a child. So I'm at the age of self-discovery. And I think this is something we've all should have been doing all along, is continually tap back into ourselves, check in and see if we are on the path to doing something that's meaningful and joyful, but also makes us some money. So, hey, so in today's episode, I'm going to revisit something that's really important. It's about getting your name out there. So if you're new to business ownership, welcome. And if you are seasoned in business ownership, you're going to really appreciate the simplicity of this, because even well-established businesses will benefit from revisiting this tried and true technique to get yourself out there. And this is as easy as 1, 2, 3. Let me tell you. So the first thing is to tell anyone and everyone about your business, that you are looking for new clients, new patients, you are available to help people, and tell everybody. Tell your friends, tell your family members, tell your existing patients, tell people who you know as acquaintances. The reason I harp on telling everybody everywhere is because most people won't do this. There is a hesitation or a fear of self-soliciting. But if you do this right, people are going to remember you, and you are going to have new patients coming to you almost like clockwork. When you hold back, people don't remember you as much. Maybe you say it one time, maybe you say it 3 times. Maybe you think that when they see you, it connects for them that, oh, this is the doctor who does this thing. But the reality is everyone is fighting for attention. And if you're only in their face once a year, it's not going to be easy for them to remember you, versus them hearing about you over and over and over again like a really good story. That's when they start remembering you, because not everyone's going to be at the place where they need you right now. They might need you down the road. So you want to be top of mind all the time. And I'm helping a business owner through this because she was asking me, how much is too much when you're following up with a business inquiry to connect with somebody? And I said, it's not annoying if you go in with the intention of saying, this is how I'm here to help. But if you go in the intention, like let's say you're following up with an email and you're saying, I'm following up to see what I can do to speed up the process. If you're trying to like negotiate a relationship, meet clients, whatever it is, if you go in with the intention of what's in it for me, then yeah, it's going to feel annoying that you're pestering somebody who maybe is just ignoring you, or maybe they didn't need you at the moment, or maybe there are other people demanding their attention and now you're fighting for that. And so your one email is simply not enough. You maybe want to follow up in a week, maybe 2 weeks. And in your emails, you follow up with information as to how it benefits them to working with you, rather than you going in there for yourself. Because when you go in there for what you want to gain, then yeah, it's going to feel a little bit salesy, a little bit uncomfortable, a little bit, yeah, what's in it for me? And, you don't want to give off that energy. So when it comes to following up with potential opportunities, I feel like if you go in there with the intention of, hey, you said you had a problem, this is the solution, is now a good time? Or maybe is there another time to follow up that would be better? But don't do that every day. Maybe follow up at 1 week and then 2 weeks. And then one more email that says, this is my third attempt. I don't want to bother you if you're not interested in this engagement. Just wanted to make sure that this email makes it into your folder. Give the person the benefit of doubt that they're busy, they're inundated, this is not top of mind issue for them, and so on. So that's why I say tell anyone and everyone, because the more you tell them, the more it will reinforce some of the information that's slipping past them. So one time is not enough. The second step to getting yourself out there is to make an offer. What are you actually offering? What I mean by that is when you meet somebody at a social gathering, you introduce yourself as Dr. So-and-so of whatever specialty, but you don't make the ask. How would they know that you're looking? How would they know what you're there for? So making the ask or making the offer is really important, because you can't show up and just assume that they will know what you want, that they will know to refer people to you. I've had this happen so many times where I'll go to a social event, people ask me what I do, I feel very hesitant. I don't want to talk about myself. I don't want to feel like I'm being salesy at a social event. I don't make an ask. And so people don't really pay attention to that. If you don't make an ask, how would they know to send people your way? And if you're terrible at small talk, which I am, and I'm trying to get better at, you make it really easy to forget you. So what do? Decide what you want to ask for. What are you offering? Are you offering to help people who have pain? Are you offering to help people who are looking for that specialty? So for me as a podiatrist, I help people who want a doctor to connect with them, to work with them through complex issues like diabetes. So I'm not an endocrinologist. I focus specifically on foot and ankle issues. So I like to tell people that I take care of people who have diabetes who might be at risk of a leg amputation. And for me, I can talk about this all day, about the importance of prevention, even if it's just as simple as getting an annual foot check. People don't know. The feet are the last thing people even think about when it comes to their health until they need a podiatrist. So making the offer to say, I'm seeing patients who have this problem. Do you think you have anybody in mind that you can refer to me? Or is there anybody I can connect with who might want to learn more about the diabetic foot? And then, you insert your area of expertise. Now, the third step, you're going to trip off of this one. The third step into getting your name out there is to repeat 1 and 2. Rinse and repeat. Simply telling yourself, showing up, going to these community networking events 1 time is not enough. 4 times is not enough. To stay top of mind, you need to be omnipresent, literally everywhere. That's why you'll find me on social media. My patients tell me they've heard about me through the radio, newspaper ad, their doctors were talking about me, their social circle mentioned me somewhere. So I am literally everywhere intentionally, because I know that it takes 8 to 22 touch points for people to even think about me as a podiatrist, that I can solve foot and ankle issues. Because most people, as I go to an event, don't have a pressing issue with their feet at that moment. But if they trip and fall, or if they encounter a loved one who's got some real medical issues, they need attention to their feet, they will eventually think about the person they've seen over and over and over again. Not the person that they met that one time at that one random event that they can't even remember. So I know this sounds too easy because a lot of us are conditioned to think that things are only rewarding when it's hard, that the value is in doing the hard things. And because more money is associated with highly technical problem solving skills, right? But I'm going to tell you the secret is in the boring stuff that is done really well. So this stuff is simple, and many people will not do it because they are looking for that magic bullet. They're looking for that magic path that is undiscovered. And the reality is this path has already been paved. All businesses are doing this and they're doing it really well and it's on autopilot. But in the beginning stages of your practice, or if you're established and you're trying to get it to be automated, you have to realize that the boring stuff works. And you have to put one foot in front of the other and tell people what you do, make the ask, and you keep doing that over and over again. So 2 ways to market yourself. The old school way is door to door. You go to these networking events, you literally knock on people's businesses and say, hey, I'm Dr. T. I am a podiatrist new in town. I just wanted to drop off some cards to the doctor here. Is there a good time for us to grab coffee or lunch so we can connect? I'm not even making an ask quite yet. But I'm telling people I exist. And if you're cool, let's go out for lunch. So that's the old school door-to-door way. And I'll tell you, at some point, this will get exhausting, especially if you're an introvert like me, where you're like, I'd rather not. And then eventually delegate it to a trusting member, this trusting staff member, and then they can do it for you. But in the beginning, you got to get yourself out there. Or if you've not done this a while, you'll be surprised at how reigniting this door-to-door technique is going to bring more people into your practice. So just do it. And then the second thing that you can do is the new school way of marketing, which is going to be online. And that means getting those Google reviews, asking people immediately after a positive interaction, hey, it would mean so much to me if you can give us an online review. And then you send them the link or you ask them to do it right there in the office while they have their phone out. And then developing your social media so that you continue to be top of mind for those who are using the internet. They're on social media already. And if you think your people are not on social media, well, there's about 1 billion people using Facebook and Instagram and TikTok. So I think you can handle a few more new patients into your practice. So being intentional with your social media, doing the same thing, telling people what you do and making the ask. Online, we call that the call to action. What do you want people to do when they see your stuff? Do you want them to follow you? Do you want them to download a free PDF, get on your newsletters, make a call to your office? So those are the call to actions. So these 2 spaces are spaces you should be simultaneously, making sure you connect with people in person, because those in-person connections takes a referring patient much further than an online one. The online one, you have to develop relationships a little bit differently. But if this is all new to you, at least do the door-to-door, face-to-face interactions. So let's talk about what it means to make an offer. This is something that took me a long time to understand. You know, I was buying all the gadgets and I'm like promoting it. I've got a new laser. I've got a new shockwave machine. I've got a new injection. But the thing is, people don't buy those things. People want the end result. They don't want you to over-explain, get technical, medical jargon, vague solutions. They don't want any of that. They don't want your course. They don't want your membership. They don't even want that procedure. They definitely don't want the surgery. But what do they want? They want the end result. So here's what that could sound like. For example, if they have foot pain, what is the result? They want the foot pain to stop. That's what they're paying for. They have a complex medical issue. What do they pay for? They pay for a proper diagnosis and a plan. So if they have a medical illness that cannot be explained, they will pay somebody who is good at figuring out the hard stuff. If they have an unstable medical condition, these people will pay to live a normal life. So people are paying to feel like their normal selves. Medicine is trying to fix something. So when you market, you are marketing yourself as somebody who has expertise, somebody who knows the specificity of that problem and the nuance of that problem. You want to be sure that you're not marketing yourself as a technician, because if you're like, I've got this machine, I just got to buzz the problem away and that's it. Well, then how do you stand out from somebody else who can hold the same probe, the same instrument, and do the same thing? So marketing yourself as a technician sounds like we now offer laser therapy. That's medical jargon. That's tech talk. Whereas if you're going to market yourself as the expert, you have to educate as to why people have the pain and the solution you have to offer and why it's better. Let's talk about ways to market yourself the wrong way using medical jargon. If I show up and I say I treat hallux rigidus with MIS, and people don't know what hallux rigidus is, they don't know that's the cause of their foot pain because they haven't received that diagnosis, or they've never heard the term MIS, it's not going to connect. Other doctors will get it. They'll be like, oh, that's cool. But you're not marketing to other doctors. You want people who don't know you to know you, who need your expertise to know that you can help. So you got to start speaking in a way that they can understand, which means you speak in a way that speaks to their pain point with a solution. Here's more medical jargon. We offer regenerative solutions for pain. What is that? Nobody knows. Even though I say minimally invasive, and I've said it a million times now in my career, the general public still don't know what that is. And they even get the words tangled up. They'll come in and say, I want that laser treatment for surgery. So just because we've said it a million times doesn't mean the general public knows what it is. So what is the actual formula in your offer? Okay, let's do this. You start with a positive outcome, pain relief, plus without blank frustration. Okay, so you take a positive outcome that they want, you add the word without, and then the common frustration. What does that actually sound like? Get back to hiking without surgery. It's true, people don't want surgery unless it's aesthetics. But even with aesthetics, people are like, can I do something without surgery first? But if you have a non-surgical practice or a minimally invasive type of practice, you are saying to them, you don't have to have surgery. You can get back to your regular life without it. So even if you have a regenerative solution, that's how I would phrase that. Another example, feel like yourself again without more drugs. So feel like yourself again is a positive outcome. You added the word without, and then you inserted that frustration that people have without feeling like a number in line, without another prescription, without another narcotic, without a surgery. So think about the things that people are frustrated with, and you insert that into your offer. So we want to paint the picture of what life looks like without the problem. And then we get into why your solution is different. So your solution needs to contain a couple of things. This is kind of like a recipe. Everybody can bake a chocolate chip cookie, right? But there are different variations. There are different subtractions, additions, replacement, and so on. You want to think about your packages like that. When you sell something to somebody, it should not just be one item. It should not be something that's comparable to insurance. Otherwise, you're making it very hard for them to choose you over the insurance option. So that's how you want to think about packaging your offer or your solution. So your recipe or your package will need to include social proof that it's worked on others before. So that can come from a testimonial or evidence of other patients having success. And it also needs to speak to how this is a better option. Needless to say, people don't want surgery because there's a lot of downtime. So I speak to that. You can have something else with a shorter downtime. And here are the people who have said, yeah, it was a great option for them and they're recommending it to other people. And that's through the online Google testimonials or even a video testimonial talking about their positive experience in your office. This is so important for people who doubt your expertise, especially if you look young. People will always question those who look younger than their stated age or simply just younger than the patient's age. And I've had a patient say, I can't take your recommendation seriously because you look so young. And by the way, you let that person go. Don't try to prove yourself to anybody. But nonetheless, You can have online social proof that helps you build your case as to why people should choose you. And I bet you can go back to some of the stuff you produced online to promote your practice that you can revisit and revise. A lot of us are kind of stuck in the physician talk where we speak about our stuff and it attracts other physicians because it's physicians speak. But if you're trying to reach a broader range of people who need your stuff, who are not in the medical profession, you're going to need to expand the way you communicate and simplify it so that they understand the end result is no pain, or the end result is a clear diagnosis with a plan, or the end solution is having a relationship with your doctor so that if you need us, we'll be here. So realize that when you craft your message, whether it's in person or online, this all takes time. And once you create a great offer that people are actually taking and you see evidence that it works, then you can start adding fuel into your marketing campaigns, like running paid ads, for instance, more effectively. But if you don't know what you're offering, it's not clear, it's not hitting the right target, then it really doesn't land well. And you're not even sure if it's going to attract the right person. That's when you find yourself spending a lot of money on ads. It gets really expensive doing it this way. So in a nutshell, in order to get your name out there, you got to tell everybody what you do. You got to master your messaging, your offer, and then you rinse and repeat. When you rinse and repeat, you also need to refine. So it's through that refinement, which is very tedious, very boring, very unsexy, but it's through that work that you eventually find that masterpiece, that piece of gold that you can run with and generate lots of profits in your practice. Most people will get frustrated. Most people will find that they're not attracting the right people into their practice. But realize you're not going to get it right on your first offer. And that's totally normal. So just stay persistent. And most of all, have fun with it, because then you'll become the version of yourself who makes it happen. Join me on the Facebook group site so we can start practicing the offers and making sure that we are communicating our values clearly to our best prospective patients. I'll see you on the other side. Take care.
If you enjoyed this episode, please give it a review and share it with a friend so more doctors can learn about direct care. Let's keep the conversation going on LinkedIn so we can help more doctors escape insurance and thrive in private practice. Thanks for listening. I'll talk with you next time. Take care.